Yes, today I will go straight and talk about certain group of individuals, certain women who have lost pregnancies after the first 3 months. You became pregnant, all of a sudden you lose the pregnancy after 3 months, especially if it occurs in these characteristics I'm going to mention. Number one, you've been pregnant multiple times, maybe three or more times, and all of a sudden you lose the pregnancy after the age of, after 3 months of the pregnancy. Now, the first one is around maybe around 20 weeks. You lose the pregnancy, and usually the pregnancy starts with a painless um, pregnancy loss or gush of fluid, and then followed by expulsion of the product of conception. The second one, have a lower gestational age, maybe around 16 weeks or so. You are pregnant around 16 weeks. The second time you lose the pregnancy, following the same characteristics, you will just notice that there is a dragging sensation in your lower tummy. All of a sudden, you have gush of fluid from your vagina, and then you lose the pregnancy. And then the third one, again, you notice that you are pregnant around 13 weeks, of your pregnancy. You notice a dragging sensation on the lower tummy or lower back, and then the next thing is that membrane will rupture, and then you see gush of fluid, and then the pregnancy comes out. If you have ever had this kind of characteristic loss of pregnancy, what you are having is recurrent second trimester pregnancy loss. Recurrent second trimester pregnancy loss. And the major cause of this type of pregnancy loss is what we call cervical insufficiency or cervical incompetence. Yes, that is what is causing it. When you have a pregnancy loss that is um, in decreasing order of gestational age, that is usually painless, and then the woman will, give you a history of sudden gush of fluid, and then pregnancy loss follows it. That is the typical characteristics of the women I'm talking about this afternoon. All right. So if you've experienced such, if you had such experience, please draw your chair closer. I'll be telling you what is likely the treatment of your condition. You are not alone in this. It simply means that there is a weakness, the mouth of the womb. It has a weakness which would have resulted from injury. Maybe your cervix may have sustained injury during either a previous pregnancy event or previous uterine instrumentation or whatever, but there is obvious weakness due to injury that prevents the cervical, status or cervical ring to lose its integrity, enabling it to, not to function well. So, but if you're having this challenge, it means that there is weakness on the mouth of the womb, which is the cervix, that has prevented the womb to be able to carry the pregnancy up to term or up to the age of viability, resulting in those recurrent pregnancy losses. Now, what is likely going to be of course, you need to be evaluated properly to make this diagnosis. Cervical incompetence or insufficiency needs to be made. All right. Now, it could be made from history, like I've just told you, characteristic history, or it could be made by investigation when you become pregnant, and then you'll be properly investigated to find out whether there is shortening of your cervix or no shortening of your cervix. If they do a transvaginal scan and it's noted that your cervix is shortening, becoming less than 2.5 centimeter, at around 20 to 22 weeks, then a diagnosis can be made that you have cervical incompetence and all that. Or if there is funneling of this, membrane into the internal os, and then that diagnosis can also be made. Now, in terms of treatments, if you've experienced this type of history, you need to identify a good gynecologist or a good obstetrician that can assess you properly and offer you appropriate treatment. It means that in your next pregnancy, that mouth of the womb, the cervix that is weak, needs to be strengthened. It needs to be strengthened by suture. We call it cervical sacrilege. That type of suture is called cervical sacrilege. You need to put cervical suture there in order to strengthen that cervix. And this suture is usually put around 12 weeks to about 16 weeks, so that it will help to support the pregnancy until about 38 weeks, when it will be removed, so that if the woman wishes to give birth, the woman can now give birth. All right. Now, apart from this cervical suture, there is also progestogen can also be given to you, all right, in order to support the pregnancy, to be carried to the age of term or towards term, or up to 36 weeks. so that the baby can survive. You are sure the baby can survive. So these are the options of treatment. So, but the critical thing here is that once you have this type of history, you must identify a good gynecologist or a good obstetrician who can evaluate you, taking your history, examining you, and then carrying out certain investigations to make this diagnosis before the treatment is offered to you. Don't get it twisted. If you have cervical insufficiency, the proper treatment is to insert what we call cervical sacrilege to strengthen the weakness at the mouth of the womb, that's at the cervix, so that the cervix will be able to be strengthened to be able to carry pregnancy up to the age of 36 weeks and beyond. All right. So catch you some other time. Share this video, share this video, share this video, so that people who are having this challenge will see this video and know exactly what to do. Cheers.